Good evening. My name is Sibongi Letito. I'm a medical doctor by profession, and my passion lies in public health care and making it as functional as possible and making it as accessible to a lot of people. The most people in South Africa, even the people in the most remote areas of the country. I believe that being a part of this program would advance my cause and ideals of just trying to make healthcare more accessible and removing and overcoming, perhaps not removing, but overcoming the barriers to healthcare, to accessing healthcare by people who would not otherwise have it the most accessible to them. I think that with the kind of startup that I've had, where we're looking at actually bringing the healthcare worker and the health professional and just good quality healthcare as well as emergency healthcare to the doorstep of the patient would relieve a lot of the burden that we've been seeing in South Africa with the rising incidence of mortality and morbidity as a result of people who are unable to actually access healthcare from being from things like disability, financial exclusion from the access to healthcare, and just being unable to access it because of the stigma that arises on it. And I think that the kind of startup that I've come up with is one that speaks to the idea of bringing healthcare to the home, and that people actually heal more. The studies that prove that people actually heal more and they recover better from a lot of ailments when they are in the comfort of their own homes. Why put a person into a hospital setting if they do not need to? Why put them in a certain facility that is ready for something that is stigmatized in society? Rather, if someone wants to do an HIV test, for instance, why not do it at home? And so I think it's high time that the 80% of the country that is unable to access quality health care, if they do not have medical aid, gets their breather and gets their chance at accessing healthcare maximally through the startup that I'm trying to perceive. And I think that amongst the bank's best candidates for this particular program, because I'm truly driven by the social impact. And I think that in as much as there's potential there's room for potential revenue, I think that what should drive most of the things that we come up with as innovators is that people must benefit. The primary people that these things are meant to benefit must actually receive those benefits, and they must we must maximize on that before we think about profitability. And I think perhaps that's the strength or the weakness of my ideas approaching this sector of innovation and coming up with sustainable solutions to healthcare and health system related problems in South Africa.